Childcare at infant centres is expensive. But what if I told you that prices were driven high in part due to state-level government regulations? The average yearly cost of full-time infant care varies from around $5,000 in Mississippi right the way through to $24,000 here in DC. That represents a big chunk of median income for single-parent households in both places. As families struggle with these costs, politicians advocate for more government childcare subsidies and expanded tax credits. But existing interventions, from mandated staff-child ratios right the way through to government qualification requirements for carers, make childcare much more expensive than it need be. Now, both regulations are of course implemented with good intentions. Limiting staff to care for a given number of children is supposed to improve safety and ensure better carer-child interaction time. Likewise, having well-qualified childcare workers is supposed to improve child development. Yet, as with most government policies, there's unintended consequences. Restricting the number of children that workers can care for raises the costs of running a centre for a given number of children. And restricting the supply of available workers through qualification requirements has similar effects. By raising costs, both these regulations reduce the supply of infant centres. Looking across states, some economists estimate that tightening that staff-child ratio by just one child can reduce the number of infant centres in a market by around 10%. Increasing the required years of education for centre directors can likewise reduce the number of infant centres by around 3.5%. Worse, these reductions occur almost wholly in low-income areas, driving up prices and reducing availability of formal care for the poor. This is all terrible news for low-income families. It hits them financially, it reduces their care options, and it makes it much more likely that they use forms of care that they prefer not to. Before dreaming up new programs to subsidise childcare, state-level government should be looking to reform these regulations. Relaxing staff-child ratios at all ages, for example, has been estimated to reduce childcare prices by between 9 and 20% in the average market, and all that without harming quality. Easing regressive regulations like this would therefore not only reduce prices for poor parents, but give them more options and more opportunity. For more details on regressive regulations and the harmful impact they have on the poor, read my paper, Government and the Cost of Living, at www.cato.org today.